Hello and welcome to Medical Dialogues. I am Dr. Bhumika. Here is what I bring to you from the world of medicine. 1 in 3 cancer patients visit emergency department 90 days before diagnosis. About 1 in 3 patients diagnosed with cancer in Ontario visited an emergency department in the 90 days before diagnosis, found a new study published in Canadian Medical Association Journal. In a study that included more than 650,000 patients diagnosed with cancer between 2014 and 2021 in Ontario, 35% had visited an emergency department in the 90 days before diagnosis. Among patients with emergency department visits before their cancer diagnosis, 64% had visited once, 23% had visited twice, and 13% had 3 or more visits. More than half of patients with an emergency department visit before diagnosis were admitted to hospital. Most emergency department visits were related to symptoms of the type of cancer diagnosed. Patients later diagnosed with colorectal cancer had emergency department visit related to bowel obstruction and abdominal pain. And those with gastroesophageal cancer had emergency department visits related to gastrointestinal bleeding, difficulty swallowing, and abdominal pain. Patients with brain cancer had high odds of visiting the emergency department before diagnosis for weakness, confusion, or seizures. Several patient groups were more likely to use the emergency department prior to a cancer diagnosis, including older adults, people from rural or northern areas, those living in marginalized neighborhoods, people with multiple illnesses, and those diagnosed during the COVID-19 pandemic. Patients who had immigrated within the previous 5 years were less likely to use the emergency department before diagnosis. Thank you for watching Medical Dialogues. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.